Gambling disorder is a disorder that is sanctioned by the American Psychiatric Association as a legitimate disorder having merit. And in fact, it's classified in the exact same section as drug and alcohol use disorders. And part of that is because the science over the past decade has really made a compelling argument that even though this is a behavior, it can be addictive in the very same way that drug and alcohol can be addictive for an individual. And the science bears that out in various fronts, looking at the way the brain operates and various pathways in the brain and regions of the brain that are activated and triggered, pleasure reward circuitry and all of that. And the neurochemical response to gambling is similar to the same way that someone responds and reacts to drug and alcohol addictions. The American Psychiatric Association, in their Bible of Psychiatry called the DSM-5, has come up with 9 symptoms of the disorder. And an individual has to have 4 of these 9 in order to be diagnosed by a mental health professional as having a gambling disorder. The first is tolerance. This is the idea that people gamble with increased amounts of money in order to get the same high or level of excitement. And part of that is because people get desensitized over time and they need more and more in order to feel that same rush. People also experience withdrawal, and that's that feeling of restlessness or irritability when trying to stop or cut down on gambling. People also report things like sleep disruption or sleep disturbance. And even though people have questioned, like, how is that even possible with a behavior as opposed to an actual substance in your body? And yet we've had study after study that have shown, like, no, these are real things that people experience who have had a gambling addiction and are trying to stop gambling. Obviously, control is a factor, and the idea that people have this multiple unsuccessful attempts to try to stop or cut back on their gambling. And so, another symptom of a gambling addiction is this idea of diminished control, this perception like I am powerless. I have tried and tried on my own, and yet I keep going back to this again and again. Another symptom is preoccupation, and this is the idea of people thinking about gambling again and again, and having it just spend so much time in their brain consuming their thoughts about, the last time they gambled, how they can get more money to gamble, or, handicapping or planning their next gambling venture. We also see people using gambling to escape, and this is much like people who use drugs and alcohol to kind of deal with uncomfortable, unpleasant emotions or stressful experiences in their life. And part of that is because just like drug and alcohol addictions, when people turn to gambling and they get that mood-altering experience in the brain, that is activating a whole constellation of neurochemicals: norepinephrine, gamma-aminobutyric acid, oxytocin, dopamine, serotonin, and it creates that chemical cocktail in the brain that gives them that mood-altering experience. And they use that to kind of escape or distract themselves. And again, perhaps people do that from time to time, and those people wouldn't be diagnosed with a gambling disorder. We're talking about the idea that someone's using this as a Band-Aid or a coping mechanism most of the time, if not all of the time. And that's why it creates all of these other problems for them in their life. They just don't have any other coping mechanisms. We often see another symptom of chasing, where after losing money, gambling, someone might return the same day or the next day in order to get even or chase their losses. We also see people lying. That's another symptom, this dishonesty to family members, and they might, and friends and loved ones. They might lie to conceal the extent to which they're involved in gambling, or the negative consequences they're experiencing with gambling, or how much they've lost, how much money they've lost gambling, or even fraudulent behavior that they've engaged in order to get money to gamble. Another symptom is this notion of jeopardizing relationships, that really gambling becomes their primary relationship. And every other relationship, whether it's a marriage or a romantic partner, or whether it's their family or friends, or even their employers, their physical health, all of these other relationships are compromised and jeopardized for the sake of gambling. We see people that will call in sick for work and go to the casino and gamble all day. And, they're putting their jobs at risk, or lying to spouses, and they're jeopardizing the trust and the relationship that they have with the romantic partner. And the ninth symptom is this idea of bailouts, that because this persistent problem pattern of gambling and over time losing money, that they get into financial problems, and then they have to turn to loved ones or family members in order to bail them out of these desperate financial situations that have been caused because of the gambling behavior. And I've had patients go to really extreme lengths, like, my uncle died. They don't even have an uncle, and they set up a GoFundMe account and have a bunch of people donate money for this allegedly recently deceased uncle, and then they took that money and went and gambled with it, and we come to find out they don't even have an uncle. And so collectively, when we see patients that have 4 out of these 9 symptoms, that's the threshold that we use to diagnose somebody with a gambling disorder. But I will say that not all symptoms are equal. And so, depending on which symptoms they are, it could be more distressful or more interfering more with a person's life. Also, just because someone may not have 4 of the 9 of these symptoms, it doesn't mean they don't have a problem. We see people with maybe even 1 or 2 of these symptoms, depending on what they are, that can be having serious problems with gambling, and they need help and interventions at an earlier state so it doesn't progress into a more serious gambling disorder.